Lyme standard that you get at the doctor was set in 1994. We've learned so much in 30 years. This protocol badly needs an upgrade. The most important of which, in my opinion, is running multiple species of Lyme. That absolutely should be done yesterday. Hello, everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hello, I'm Dr. Warren, and today I'm going to try to run through everything you need to know about Lyme disease and Lyme disease testing in a condensed way. So this is really important because it's the first line when people think they're sick, they go to the doctor, they get tested, you assume that test is accurate, and unfortunately with Lyme, that is not a safe assumption. So the really big point here is we want early diagnosis, but you also want accurate diagnosis, and that doesn't happen well with Lyme. So Lyme is a bacteria called Borrelia burgdorferi, and there are other species of Borrelia that can also cause Lyme, and we'll talk more about that later because it's a huge portion. It's one of the big mistakes is doctors are only testing Borrelia burgdorferi and they're not testing all the other kinds of Borrelia. If you're doing that at this point, you're doing it wrong. You're going to miss about a quarter of the people that walk into your office who really have Lyme disease. They have Borrelia something else like Mayoni, which was discovered at the Mayo Clinic, or Guarini, or Afzelli, or Californiensis, or some of these other versions of Lyme that are not just burgdorferi. Really need to run multiple species of Lyme when you're running a test. Lyme disease is a bacteria, and from a symptom point of view, what we really start to think about is any flu-like illness. It can look like that in the acute, meaning if you got bit last week, it can turn into a inflammatory flu, joint pain, headaches, these kinds of things. But in the chronic, we're looking for fatigue, pain, that can be muscle pain, joint pain, headaches, neck aches are the big ones, joint swelling, and then all kinds of neurological issues. So neuropathies, trouble with words, insomnia, anxiety, depression. It can hit the nervous system pretty hard and cause a variety of nervous system symptoms. So the big symptoms you're looking for are fatigue, pain, and neurological. If you're lucky, you have all three categories. That's sarcastic. But that is really the big stuff we're looking for in Lyme disease. The most obvious sign is if you have a bullseye rash, that's the dead giveaway for Lyme. What's nice, if you have that, it's easy to catch. It looks kind of like Target stamped you. But you can get other rashes that don't look exactly like that. And some people don't get a rash at all. So if you get the rash and you know you've been exposed to ticks recently, that's kind of the slam dunk it's Lyme. And you should proceed forward assuming, your doctor should assume that it's Lyme. One of the problems we see is that doctors are never told to rely on the test 100%. They're taught to take into account your history, your symptoms, what's going on with you, and then use the test to confer. And sometimes we see doctors don't do this. They just ignore all the other evidence and go based on the test. So that is wrong to do, not recommended by anyone ever. All right, so for clarification on what types of tests there are or what conditions this kind of mimics. So there is an ELISA test, which is the screener test. I really think this is just bad, outdated technology. This was originally done so that you could get testing done really fast in a hospital setting. And maybe for that purpose, it's still somewhat useful because you can get a test really fast. But if you've been sick more than a month or it's not an emergency situation, you should just run a more thorough test. So you can make immunoglobulin M within 3 to 7 days of being sick. You can make immunoglobulin G within 3 weeks. Like the test we run, which runs PCR, immunoglobulin M, and G, you'd start picking up PCR right away, and you'd start picking up the M's within 3 to 7 days. So by the time you're feeling anything, you're going to get around to testing, it's going to start showing up on these tests. Now, if you've had it long term, it'll still show up when you run thorough testing that has multiple markers. It doesn't always look screaming high the way it does when it's acute, but that's the problem with chronic is it moves into this phase where it's still there, but it's not as aggressive. So we tell people it doesn't kill you, it just makes you really miserable. So, but you can test really as long as you've had symptoms for 3 to 7 days and beyond, you should be able to pick it up on some kind of a test. The standard is the ELISA, as we've already said, and if that's positive, they'll do what's called a Western blot. Now, I just think the ELISA should be eliminated. It is, for the most part, misleading. It's a very oversimplified test that misses a huge portion of people and falsely leads doctors down the wrong road. The next problem we run into is The Western blot is a more thorough 10 markers for Borrelia burgdorferi. And the issue we've run into is, first off, if you're just going to run Borrelia burgdorferi, there should probably be 14 markers. They take off band 31 and 34 because they used it to develop a vaccine. When they cancel the vaccine, they never put those markers back on, which is just stupidity. They're great markers. They should be added to every Lyme panel at this point. I also think we have good evidence to add C6 and VLSE1. Once again, these are just proteins. I'm sorry for the nerd talk, but these are just proteins that match that Lyme has that not a lot of other bacteria have, or that no other bacteria has, which makes them terrific markers if your immune system is trying to fight them. We know that it's fighting Lyme disease. So that should be, at a minimum, you should have an upgraded blot. Now, the other part here is you need to test for other species of Lyme. If you're not running a panel that includes Borrelia mayoni and Borrelia hermsii and Borrelia spielmani, it is incomplete. About a quarter of the people who come into my office and they're slipping through the cracks of the medical system and no one can figure out what's wrong with them, they just have a different version of Lyme. And people ran just the burgdorferi version. Once again, it's the first one we discovered, but it's not the only one we've discovered. But by that one oversimplification, if we were to just fix that tomorrow, I'm convinced a quarter of the people who I see would be found immediately have to run multiple species of Lyme. Now, the other test I get a lot of questions about is a PCR test. PCR is where you're actually finding directly the bug, as opposed to the immunoglobulin test, you're finding your immune system fighting the bug. Now, it's wonderful if you can find a PCR positive. The trouble is, once Lyme has gone chronic, it reproduces much slower. This is true of the co-infections as well. So the cell counts are lower, which makes it more difficult to find on a PCR test. We run a lab that just runs both. We run immunoglobulins and PCR testing because they're two different ways to look at it. And if you find PCR testing, it's extremely definitive. But it is hard because you have to get it in the 1 ounce or 2 ounces of blood that you're drawing, which is not a huge sample if you're trying to find something once it's gone into the more chronic state, but still can be extremely definitive if you can find it. Always a good idea to run some kind of both. I always run tests that have both direct recognition and what's called indirect or immunoglobulin recognition. And you're really kind of interested in both things. You want to know if you can find the bug directly, and you want to know what your immune system is trying to fight. Both of it is very good information to try to figure out what's happening to you and know a good target for getting better. What does the testing process look like? It's pretty easy. We send you a kit. The kit has normal blood tubes in it. You take it to a nearby phlebotomist. In the cities and around most places, we send you to a place called Any Lab Test Now. They just act as the phlebotomist, and they'll draw the blood, ship it to the lab. 3 weeks later, you get your blood test results. And once again, I prefer an extremely thorough version of this test because I ran the regular test on my wife. It was negative, and I spent 3 years doing the wrong thing. And the biggest waste of your time and money is just barking up the wrong tree. So if we want accurate testing, that is really the key here. And the standards badly need to be updated. The Lyme standard that you get at the doctor was set in 1994. We've learned so much in 30 years. This protocol badly needs an upgrade. The most important of which, in my opinion, is running multiple species of Lyme. That absolutely should be done yesterday. Who needs to be tested for Lyme? What are the symptoms? The two diseases this mimics the most are rheumatoid arthritis and probably, I'll say MS on the neurological side. So Lyme disease looks like an inflammatory arthritis to many people. You get muscle pain, joint pain, headaches, neck aches. So you end up at someone like a rheumatologist. And in general, Lyme disease is a little confusing to the rheumatologist because they've been taught for 30 years chronic Lyme's not real. Now, the CDC has changed their opinion on that as of 2022, but that doesn't mean the 30 years of education the rheumatologist has had is undone in a year. So they've been taught Lyme's not real, so they can't downplay it, but they get confused because it looks like rheumatoid arthritis, but your RA markers don't really hit, and it looks like some kind of inflammatory arthritis, but it doesn't show up exactly like that. So sometimes rheumatologists will just say dismiss you and say your tests are negative, go away. Sometimes they'll give you a diagnosis, but a lot of times it's something like, well, we're going to go undifferentiated connective tissue something, or seronegative RA, which means they swear it's some kind of inflammatory arthritis, but they're having trouble finding anything. If that's your case, where it looks like a rheumatoid or inflammatory arthritis, but your tests are negative, we get very suspicious of Lyme disease. The other side is Lyme can cause many neurological symptoms, hit the nervous system very hard. Columbia University has really taken up the banner on this, that Lyme disease can present very neurological. For that reason, it can cause sleep problems, anxiety, depressions, neuropathies, and any kind of central nervous system it can hit. So it can really look variable in the nervous system. Once again, we go to the neurologist. They can find something that's happening, but they have no idea why. So they'll say, I can't figure out what's wrong with you. I'm getting stumped. I don't quite know. If that's happening, we're going to a neurologist who has some kind of neurological problems, but they're having trouble pinpointing it. We really start to escalate Lyme up the possibility chart here, because that's what it can do. Now, a mysterious, non-pattern-like neurological disorder is also MS. And so sometimes we get this thing where it looks kind of like MS, but they don't maybe want to call it MS, but maybe one doctor does and another doctor doesn't. And so we're in this, do I have MS? Don't I have MS? I don't care what it's called. How do I get it better? If that's you and you have exposure to ticks, then running an extremely thorough tick-borne panel, I think, is highly valuable, because if this is really coming from Lyme disease, you can fix it, you can get better, you can be healthy, and you can move on with life. Those are probably the two most common misdiagnoses I see with Lyme. That and anxiety. Anxiety is probably a huge misdiagnosis for Lyme. And what that is just you have something wrong with you. They can't find anything, so they have to chalk it up to something, and you just get labeled with anxiety, really because they just can't find it. One of the keys that we want to share for Lyme is just the current testing protocol leads to very few false positives and an extremely high amount of false negatives, which is where you get people who are really sick and the testing misses you. And this happens because, one, they don't test for co-infections. That's a whole nother thing, but 93% of people who are chronically sick have a co-infection. We have other videos on that. But Lyme, they're running a very simple screener test that's not very thorough, and then they're using very strict criteria for the Western blot. We want to run multiple species of Lyme. I don't like the ELISA screener test. I think it's just misleading. If it's positive, fine, but if it's negative, it doesn't mean anything to me. I think it's a poor screening test, and you really should follow up with something more thoroughly, at least running more bands on the Western blot, but probably running more bands and running multiple species of Lyme. I think that just should become the standard whenever they're going to update it. Maybe we should update standards more than every 30 years. Based on your test results, what should you do? So we recommend, if you're having questions about test results or wanting to run thorough testing, you just reach out to us at the clinic. We have terrific testing available. We have information on that testing, because we think really thorough, clear testing helps you know what you're fighting. And if you know you're on target, then you're going to get to your health goals faster and better than if we don't know exactly what we're doing. I'm Dr. Warren. Hope you found some of these questions and this video helpful.